Heart failure is a chronic condition in which the pumping action of the heart becomes less and less powerful. Your heart muscle becomes weak and is unable to contract or relax enough to meet your body's need for blood and oxygen. The weakness occurs in the lower chambers of the heart, also called the ventricles. To compensate for this weakness, the heart usually builds up its muscle mass and produces certain hormones to assist. The enlarged heart initially does pump more blood. Eventually, the compensation made by the heart leads to deterioration or more damage of the heart muscle and less efficient pumping. The result is an enlarged heart that does not provide adequate blood and oxygen to the body. Left-sided or left ventricular heart failure is the most common form of heart failure. The left ventricle provides most of the heart's pumping power. When the left ventricle weakens, the left side of the heart must work harder to pump an adequate amount of blood. There are two types of left-sided heart failure. Systolic failure occurs when the left ventricle loses its ability to contract normally. As a result, the heart can't generate enough force to push an adequate amount of blood into circulation. The heart does not eject all the blood delivered to the left ventricle. The percentage of blood that is ejected from the heart compared to the amount of blood at the end of the ventricular filling is expressed in a percentage called the ejection fraction. The other type of left-sided failure is diastolic failure. This occurs when the left ventricle loses its ability to relax normally. As a result, the muscle has become stiff and the heart can't fill with enough blood during the resting period between each beat. When the left side of the heart starts to fail, fluid collects in the lungs. This condition, called pulmonary edema, makes it more difficult to breathe because fluid is in the spaces where air should be. For this reason, diuretics may be prescribed. Right-sided or right ventricular heart failure usually occurs as a result of left-sided failure, but can also be the result of a heart attack that damaged the right ventricle. When the left ventricle weakens, increased fluid pressure forces blood back through the lungs, damaging the heart's right side, reducing the pumping power. When the right side of the heart loses pumping power, fluid backs up in the body's veins, usually causing swelling in the feet, ankles, and lower legs.